Hello everyone, I'm Alianza, your health informer. Welcome back to my YouTube channel. In this channel guys, we are talking more about health tips and health benefits. Kung bago pa kayo dito sa channel ko, huwag niyong kalimutan na mag-subscribe at pindutin ang notification bell para updated kayo lagi kung mayroon akong bagong upload na video. Maganda ang topic natin ngayon. Very inspiring for everybody. Let's go na guys. Umpisahan na natin ang topic natin today na sinasabi kong very inspiring lalo na doon sa mga naninigarilyo. So, ang tawag ng topic natin today is smoker's cough. Ano ang tunog ng cough na normal na ubo or cough na nanigarilyo. What is smoker's cough? Smoker's cough is a persistent cough that results from damage to the airways caused by toxins in cigarette smoke. If you smoke and have cough for 3 weeks, you may have smoker's cough. Ma-describe natin ang smoker's cough na yan is a forceful, a cough can lead to hoarseness and chest pain. And it can also be a sign and symptoms of lung cancer. Description natin dito sa smoker's cough is a forceful forcing out of air to clear an irritant from the airways. Parang mayroong nagbabara. Ang smoker's cough may be persistent and nagging, lasting more than 2 or 3 weeks. Cause a wheezing or crackling sound, be wet and productive, phlegm or sputum is present. The complication is a repeated hard coughing can strain chest muscles and even lead to be broken ribs. A woman with persistent cough may leak urine due to pressure put on the bladder. Nakakaihi na sila sa pag-uubo. We have a cells that line in our airways. We call it cilia or tiny hair-like cells. The function is sila ang nagka-catch ng toxins in inhaled air and move them toward the mouth to prevent them from reaching the lungs. So, yung cilia na yan or yung tiny hair na yan na like cells that nandito sa airways natin, yun ang nagsasala sa mga ini-inhale natin galing sa labas. Pag ikaw ay nanigarilyo, the certain chemicals from the tobacco smoke such as formaldehyde paralyze these delicate structures or that cells na sinasabi ko, yung or tiny hair dito sa airways natin na dapat yun ang nagsasala sa lahat ng mga na-inhale natin galing sa labas. Pero kung nanigarilyo ka, it will paralyze this delicate structure and make them unable to capture the toxins. Dahil doon sa chemicals ng tobacco smoke such as formaldehyde. So that toxin galing sa tobacco smoke are able to enter the lungs where the settle and spar inflammation. The smoking affects in the airways means toxins and chemicals in cigarettes linger in the body. So, smoker cough can be identified based on symptoms and a history of smoking. The coughing out of blood is the strongest predictor of lung cancer. Even a little blood is reason for an immediate evaluation. Coughing up a teaspoon or 2 of blood is considered a medical emergency because it can be breathed into your lungs. Symptoms that can indicate lung cancer: hoarseness, cough, wheezing, shortness of breath, unexplained weight loss, pain with breathing, pain in the upper body, specifically the lungs, shoulders, between the shoulder blades or back. The best treatment for smoker's cough is to quit smoking. As you're working that goal to stop the smoking, experience so many things. You can use your lifestyles and if necessary, medication to help improve your cough. There are many ways to quit smoking. See your health provider about support such as smoking cessation aids, include nicotine replacement therapy and medication. Some who quit smoking experience their smoker's cough increase immediately afterward, known as smoking cessation cough. This is actually normal. After quitting, the cilia are given more opportunity that they ever had while you were smoking to repair themselves. This worsening of smokers' cough after quitting is temporary. The following ways to ease your cough is stay hydrated, increase fluid intake, drink 8 glasses of water per day, gargle warm salt water, drink tea, and half teaspoon of honey is found to be more effective reducing cough symptoms than many over-the-counter cough syrup. Inhale or cement or eucalyptus. Place fresh leaves of either herb into a bowl and pour boiling water. Drape a towel over your head to contain the vapors and lean over the bowl just close enough to breathe them in. Elevate your head during sleeping. Exercise, eat a healthy diet including nuts, fruits, and cruciferous vegetables such as broccoli and cauliflower, and help the body to detoxify some of the chemicals you inhale from the tobacco smoke, which may help improve chronic respiratory symptoms and reducing lung cancer risk. Talk to your healthcare provider before you use any cough suppressants. These medicines for short terms only. A persistent cough is one of the most common symptoms of lung cancer. So, lagi niyong tatandaan yan. Kung kayo ay inuubo, nanigarilyo, tapos ang hindi lang normal na ubo ang nararamdaman nyo, magpatingin na kayo ng doktor. Kasi lagi kong sinasabi, prevention is better than cure. Hanggang dito na lang tayo guys. Sana may natutunan kayo o may nakuha kayong aral dito sa video ko. Kung may gusto kayong itanong tungkol dito sa topic na ito, mag-comments lang below. At kung bago kayo dito sa channel ko, huwag niyong kalimutan na mag-subscribe at pindutin ang notification bell para updated kayo lagi kung mayroon akong bagong upload na bagong video. Pangalagaan natin guys ang health natin kasi yan lang ang tanging bigay ni God sa atin. Remember guys, health is wealth. Hindi ako magsasawang magpapasalamat sa lahat-lahat sa subscribers and non-subscribers, lalo na sa mga silent viewers na walang sawang nanonood dito sa video ko. Sa maraming salamat sa suporta na binigay nyo sa akin, lalo na dito sa channel ko. Bye guys and love you all. Thank you for watching.